All right, so good morning. Yeah, we can start by renewing my apology. This class was to have started almost a month back, as previously reminding me. Unfortunately, the very day we supposed to start the class, that was the day something came up and I need to travel. Even though I've actually prepared my mind to start the class, at least the productive aspect. And then well, I traveled for 2 weeks, so maybe we have one online class, one online class, and when I come back, I'll have another class. Um, but nevertheless, we'll see how we can make it. I think this is also part of the plan so that we can make it up. The class is going to be divided into, like I said, the three materials we use, probably one, and three. I think we must have started to be class with the other person. But nevertheless, that is going to be that we can still capture something the content of the question that we later. So in this part of the course, we'll be discussing toxicology. We're going to give an introduction of what toxicology is. Maybe look at historical perspective because the historical perspective might be relevant to uh, what we'll be discussing for the main aim of our discussion. Uh, we talked about those response to relationship. Then we talked about pharmacokinetics and pharmacodynamics. Then the last part of the class, we look at the poison properties with the way at the type of poisons, different examples, and their mechanism of action. And then we talked about the factors modifying action poison. So this is a summary of MBTE 7.7. Now to start, this is toxicology. What is toxicology? Toxicology, we define toxicology as a branch of science or any scientific study that deal with adverse effects of uh, chemicals on biological system. You know, biological system is built out or made up of chemicals, of course. And these chemicals can either play an important role as a structural function or they serve as an metabolite, the functional role. So either it's the chemicals, either it's being involved in the structural formation or a functional role. So it serves as structural role or functional. Structural role is what we see carbohydrates, proteins, lipids, forming what we see as a biological system, like human being, an animal, an insect, and whatever. So these are what comes together, and this is what we see as the physical object, as the biological system. But it is made up of those chemical components, and these chemical components, like we mentioned, they are basically carbohydrate, or they belong to a specific class of compounds, uh, like carbohydrates, like proteins, like lipids, like acids that goes together. And still, these molecules and similar of the same class also comes together to lead the functional role, the metabolic aspect also. But here we are talking about the adverse effect of this chemicals in our ecosystem. So even though the system is made up of actually chemicals, yes, of course, these chemicals play an important role. They like in the structure, but they are rare. Some chemicals that did not constitute the component of the chemicals that made up this biological system. And if these chemicals found themselves, what do they do to these chemicals? Or what do these chemicals do to the body? So the background thing is, or the background information here is, was that the adverse effect of some chemicals? Yeah. Our biological system is an open system. It takes in substances and take out substances. And most of the things that is taken in, actually, most of, especially those that we take in intentionally were foods. And this food constitutes the major component that made up of the system. So the system recognized these things as part of them. So we take in food, and this food contains carbohydrate, proteins, amino acids, as we mentioned, and so the body knows about them. Body process them, utilize them, either for the structural or the functional. But there are some chemicals that can get into the body, and those chemicals we are not known by the body. And how does the body take care of those things? And the body, of course, will have to take care of them. But being the fact that some of those chemicals are very toxic, some of them are very harmful, some of them are very reactive, that is true that they can react, they can involve themselves in some certain biological process. We call them the bioactive chemicals or bioactive molecules. So if it happens, they happen to be bioactive. They can bind to some receptors, they can interrupt some chemical reactions, they can, but this thing can be done in two ways. It can be done positively, or it can be done negatively. If it is done positively, it is in this case, we see that how these chemicals come in and they try to restore some abnormal hemostatic processes. But if a chemical comes in and disrupts normal hemostatic process leading to abnormality, then that is the negative aspect. So in toxicology, we consider these foreign chemicals coming in, eliciting some biological functions, and these biological functions are regarded as advanced biological effect, advanced in the sense that they have a negative impact to the biological system, despite the fact that we have mentioned that some of those chemicals are positive impact. And you can have the chemicals that have both positive and the negative consequences. We'll come to discuss quite a number of those chemicals. So in toxicology was classified into different branches. Although we'll talk about a small history about the history of the field itself, and then we'll see how it has been utilized from beginning, then what leads to this classification or these branches. So we have environmental toxicology. In environmental toxicology, you are dealing with those molecules of toxic chemicals that have been produced by the environment. We have food toxicology. In food toxicology, we are talking about chemicals, toxic chemicals found in food. We have a clinical toxicology. In clinical toxicology, anything clinical dealing with disease and illness. So we're talking about the disease and illness that comes as a result of taking in some of those toxic chemicals. We have industrial or occupational toxicology, where we talk about some toxins or chemicals being produced from the place at work, etc. And then we have forensic toxicology. Forensic toxicology is what we will be discussing. So in forensic toxicology, we actually dealing with the use of toxicology to establish legal evidence. So how can this field of toxicology, how can this area of toxicology, starting from the symptoms of a toxin, leading to either a mechanism of toxin, detection of toxin, or even treatment of a particular toxin could serve as an evidence in a legal process. So this is basically what we will discuss now. So, like I said, well, I was talking about a little history of the pill itself, because the history in one way or the other, we'll see how these different processes, how these different branches of toxicology comes to be, because they happen organically. It's not something that somebody will just sit down and say, oh, we can use this knowledge in this area, we can use this knowledge in this area. So it started actually like that from there. over a long period of time, then we would have this separation or classification of branches for. So toxicology begins since human existence on Earth. So humans exist on Earth billions of years ago. But we know that human being to survive, there are these three basic needs. Talk about food, talk about shelter, and clothing. So for a human being to survive, we have these three basic needs. And these three basic needs, they are also categorized based on priority. So the priority, the most important one is food. Therefore, a human being must survive. After evolution of a human being, okay, then the next thing is that there must be a sustenance. And for that sustenance to occur, is for human being to be able to feed himself. How do you feed yourself? You get your environment around you. So when life started, when human started on AIDS, started looking at food, started looking at trees, started looking at plants generally, started looking at animals generally for that to survive. So yes, look for plants that eat, so therefore you must look for edible ones. But then you don't know there are edibles and non-edibles, plant edibles and non-edibles animals. So just maybe you start just eating anything like that. But over a long period of time, you get to discover that if I eat this, it's give me kind of reactions, it causes this, it causes that, or even kills at some points in time. And also these kind of animals also are this kind of taste, or they don't satisfy your 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 concern, your hunger. Maybe because some toxicity event or they see some symptoms. So over a long period of time, man was able to differentiate between these are edible ones and these are non-edible ones. And among the non-edible ones, even classify those that are okay, maybe they just don't satisfy their satiety. Well, another class maybe consider toxic. And this is how toxic substances were possibly taken out of. So we can say it started earlier since then. But the human being also, over time, they will have to start thinking of how can we use this kind of things then to make this easy for them. So over a period of time, they begin to use them for quite a number of things. So history has shown that these toxic chemicals, these poisons from plant and animals are used historically, hunting, during wars, state executions. Has been found in many written records out around 15 BC, 1500 BC. Record like all the record like Hindu's Vedas, Egyptian papyrus, the work of Hippocrates, Aristotle have all shown this kind of things extracted from those plant and animals. However, these poisons extracted from plant and animals had been utilized for all these processes. And in the 16th century, we have Paracelsus, who is regarded as a grandfather of toxicology. And what he did was the first person to identify some specific active ingredients or chemicals in the toxin or chemical in the plant toxin or animal toxin that are responsible for this toxicity. And he further explained that even the toxicity or the responses we see or the problem we are seeing associated with these things are actually linked or related to the concentration in the dose they've taken. So this is what brought about the concept of dose response relationship. We'll talk about dose response relationship and we'll see. Like I've started explaining earlier, there are chemicals that have positive and at the same time negative. So based on dose response relationship later on, able to identify and then determine what a number of parameters, properties that will determine whether this chemical will be regarded as And then we have 19th century scientist from the University of Paris, Joseph Matthew Opila, who is regarded as the father of modern toxicology. And what he did was he was the first person actually that coined the word toxicology itself, and he wrote a book, The Historical Toxicology. He first correlates the specific poisons to some specific toxicological properties, like this particular poison is known to do this poison is known to do this poison is known to do this, or rather this poison affects this particular organ, this poison that is organ. Over a period of time, around 20 to 21st century, we have more greater advancement in understanding toxicological properties of some certain poisons from organ. Because what the work of Joseph Matthew Popila was to actually see or to characterize the toxicity on certain organs. But over a period of time, even the molecular or cellular mechanism of toxicity, molecular mechanism of toxicity were later started. So going back to our discussion, forensic toxicology. Why forensic toxicology? Why is it important? Why? How can toxicology be used to establish legal evidences? So, but we already mentioned the forensic toxicology involved in detecting and identifying poisons or drugs. Why drugs? What here is those drugs are potentially their potential poisons also they can elicit that toxicity, and at the same time they can have the potential. Poisons only have this toxic effect, that is why regarded as poison. While drugs here were classified here, or were produce them because they can also elicit those effects that could actually useful in understanding or establishing legal evidence. They are misused. They can also, although in most cases, actually, the drugs, they are the drugs that are being misused to give some certain responses, and these certain responses can make someone, can tempt someone into committing a crime, or rather can make someone be able to commit a crime. So a forensic toxicologist's responsibility to detect and identify drugs or poisons in the body use to organ so that you can establish your own evidence. But the question is, if a drug or other drug, a poison, cause or contributes to an illness or disease? That's a question we want to answer as a toxicologist. But how do you go about answering this question? First of all, you have to be a toxicologist. And being a toxicologist or forensic toxicologist, first of all, you have to know the drugs themselves. What are those drugs? What are those poisons that can contribute to someone committing an offense? What are those drugs that can make you to behave in certain way that can push you into committing some offense? Or what are the drugs or chemicals that you can use to commit an offense? So what are the drugs or chemicals that can contribute that can help you in committing an offense? You have to know them first. After knowing them, you have to know when they enter the body, how the body takes care of them, or what happened to them in the body. So that if at all, yeah, what happened to them in the body? And what do they do? For example, what do they do to the body? When you take in them, how does the body behave? Do you behave unconscious in such a way that you entering somebody's house, you spread message to him, and it goes unconscious, you enter that whatever you want that goes out, or you take it to yourself to make you less fearless, it makes you behave in a certain way that you can easily go and commit a crime, or you use it to even they commit crime to inject somebody or to put it in food to kill somebody. So what does it mean? Giving it to someone, how does that person supposed to do? As forensic toxicology, you see somebody who is a suspect and you have to examine him. You first start by examining the way the person behaves, its look, its responses. If it's under drug, we should be able to know. So based on some certain symptoms that that person is expressing, if you know this person has taken this class of drug, this person has taken this class of drug. So you identify some certain physiological symptoms. The next thing now is to further go to verify your own. Another thing also you need to know, so if you're able to establish the fact that this person is behaving in some certain ways, so the behave in this way means he's under the influence of some certain classes of drugs. Now, how do you detect, confirm what are these things that actually starting? The easier way to help you in understanding that is how does the body respond to or take care of those chemicals? Because one thing, although we discussed that, the body will definitely have to take care of these things. How does the body take care of it? Is it excreting it in the urine? Is it excreting it in the pieces? Is it excreting it in sweat? So that you should be able to know which part of the body will you move in order to take a sample that you can be able to detect this kind of chemicals. Because some chemicals are based excreted in form of sweat. Some are based excreted in form of pieces. Some are based excreted in the while some in the air we exhale. So in the breathing we exhale, so can easily detect some of the processes. So you first have to understand these chemicals, diverse variety of chemicals that are being used in committing this kind of criminal offenses. So as a forensic toxicology, you should understand these chemicals. How do these chemicals elicit their function in the biological system? How does these chemicals, how does the body take care of those chemicals? How does the body respond to these chemicals? You should be able to know, because there are a more extensive way you can even profile a particular metabolic process of an individual who is under the influence of some certain chemicals, especially whether the body really responds to that chemical in this certain way. It's established that this that will happen if the body is exposed to that chemicals, and when you take a profiling, like metabolomic profiling, you should be able to know that, oh, the response we are seeing, it tells me that the body is actually responding to something that will lead to this particular pathway. So you should also be able to detect and isolate these chemicals, like drug or poisons in the body, different part of the body, depending on the examination. So for the last part, that has to do with detection and isolation, is what we will discuss in the second part of this class. And this class will be talking about the drugs and the poisons themselves, knowing them, knowing how does the body take care of them, and what will they do to the body. It's basically what is centered in your discussion. So before we do that, we're talking about forensic toxicology. We're talking about quite a number of disciplines, how in which way it can be used. It can be in postmortem toxicology, where they can autopsy or specimen, attempt to check the manner and the cause of the disease, what causes the things of individual diets and other influence of the toxic chemicals. We take an example from dates and then the examinations. presence of some of those chemicals that have the potential of killing visual poisons. And then it can be a urine drug testing. Urine drug testing is, for example, when you have employment, newly employed people actually will have to do some medical screening. Some of those medical screening was to ensure that they are healthy and they are free of taking all these drugs that can cause a problem for them. Imagine taking learn somebody who is to behavior of taking these illegal drugs, sometimes will be under the influence of these drugs and commit under of atrocities and even do what he's expected to do in the place of work. So or maybe during a drug maintenance program, somebody undergoing the rehabilitation see the concentration level of these substances in the metabolism system. So as time goes on, I will explain and understand this to later also, because I need to explain something here which I think still explain. So in human performance toxicology would be toxicology, how a drug influences human performance. So see certain way people behave, whether it's under the influence of some drugs or chemicals, you can be able to know physically and psychologically. If you are driving under the influence of alcohol, driving under the influence of some chemicals, taking some chemicals that are taking your sense out of you, to be able to know. So if you make a mistakes, evidence can be established that this person was driving people who did this and that just because he was under the influence of this and that. So forensic toxicology should be in a better position to be able to detect based on either physically, you should be able to know that, there are some certain behaviors observed in you, which you can do some analysis to confirm the presence of some specific. Because when you see the behavior, you should be able to think of the possible things you are expected to see that individuals. Either it is urine, either it is blood, either it is tissue samples, either it is weight, either it is breeze, or whatever, be able to go out something. So somebody would just take some drugs and go on. That can lead to assaulting another person, committing quite a number of criminal acts. So to go back to dose-response relationship, we mentioned dose-response relationship as one of the significant findings of Paracelsus, who is regarded as the grandfather of toxicology. And one of his famous statements that says, all things are poison, and nothing is without poison, depends on the dose. So everything is regarded as poison. So even the food we mentioned, remember we talked about human or our biological system made up of those chemicals that are known by the body, because they are known in the sense that the body itself is made up of those chemicals, or made up of these molecules, which we say carbohydrate, protein, macromolecules, a well-known biomolecules. So, but even then, according to this statement, they are poisons that all depend on the dose. I will get to agree with each other. Like if you're taking so much of things, stress your body, stress your kidney, stress your liver, stabilizing them, and know that the body doesn't store amino acids, they will be broken down. So when amino acids are broken down, electrons with carbon skeleton will be used for production of the fatty acid that can be stored on carbohydrate that can be stored. And then the amino group will have to be excreted. So producing ammonium, making the kidney very easy, but also very easy in the breakdown process. So if you are taking so much of these things over time, it can weaken these organs, weaken the activity of those organs, basically. So that it can be considered as a poison because they are damaging your system. And likewise, also, we know the problem of taking parts of parts that link to cardiovascular disease and obesity or whatever issues, health issues. And then carbohydrate also, taking carbohydrates, so much sugars in the system, and well, this is obesity and as well as diabetes and whatnot. So quite a number of this. So even if these things that are known by the body will serve as the main building block of the body themselves, when they are taken in more than enough, they can cause a problem. But all this thing is concentration or dose dependent. How the body makes them and what extent are you taking them determine what are they will be harmful to the body, how the body will resist, or even the body will benefit from the taking vegetables. Taking food, normal balanced diets, the body will be happy, big appetite, the body will grow, and immune system will be strong, it is strong, it is fine, okay. But if they are taking more than what we're supposed to be, it become a problem. So likewise, all the other chemicals, even though they are abusive chemicals, they were classified as poisons, and those chemicals classified as poisons simply because they are, though they have the negative, only negative effect, even as lowest concentration, smallest concentration. But the drugs, they also have the toxicity, certain range. So based on this dose response, what processors means that the dose will determine the response. And the response, like I said, can be positive or can be negative. So if initially you have the dose is increasing, the response will be increasing. You can have a point whereby you put a chemical or you give a chemical, and this chemical will have even no response at all. No effect. You reach a point where you start increasing the dose, and then you start increasing the effect, you start increasing, then you start seeing the response. The response is going up. You reach a point where the maximum response is being achieved, and then it's no longer seeing the response. This is the classical of those responses. So if, for example, you have a chemical that is toxic, initially at lower dose, there is no response. At a bit higher dose, you start seeing some response like restlessness, like this. Next, maybe it induces sleep. Next, deep sleep. Next, unconscious if you increase labored breathing, affective breathing process if you increase the dose and things, something like that. So the more you increase the dose, the more the response. There are the points there may not even be a response. So, like also I said, you can have some substances, some chemicals that are beneficial. At the same time, they are toxic. So, for example, if you start maybe giving these chemicals to our biological system, initially there might be no response. As you increase the dose, there will be a little response. The response continue until you reach half of the response, or until you reach a state where there will be no response anymore, or there will be no that positive response anymore. The positive response will stop. So halfway into that positive response is what we refer to as ED50. The ED50 is a concentration of that chemical that gives 50% positive response. We call it therapeutic dose. So this ED50 is effective dose 50. Effective dose, the dose that is effective to like 50% of the population. For example, if you have a paracetamol. And this paracetamol is meant to kill pain, to relieve pain. And you have a population of 20 people. You want to know what is the concentration of this paracetamol that is effective, at least to 50% of this population. You give them. By the time around 10 out of the 20 people say, oh, that's really killed our parents, it's been effective to us, then that is EDP, effective dose of. When you increase, you reach a point where all of them will have their pain relieved. But when you increase from that concentration, then that concentration is doing nothing to them. You reach a point whereby as you start increasing, you reach a point whereby it will start becoming toxic. So the toxic response is also different, and then that response will now be recorded also, will be going up, going up. If, for example, the toxic response leads to death, then you reach a point whereby all these people will die. But the concentration at which 50% of these people die is what is required, or what is called LV50. LV50. Lethal dose 50. So we look at the lethal effects and the therapeutic effects. So from this, you can be able to, for a given chemical, you can be able to know the therapeutic index, how extent this substance can be considered a drug or to have a therapeutic effect. You take a therapeutic index, which is a ratio of ED50, which is effective dose over LD50, which is lethal dose. And the gap between the toxic response and the therapeutic response is what we call the margin of safety. So this is basically what we call dose response relationship. So in fact, most of the drugs, the reason why we are talking about drugs here is because most of these drugs are actually taken by people that are not supposed to take it, number one. So the effect they will see will be higher than the effect of those people that already have a problem. Because like we say, we have a homeostatic shift. And we want to restore the homeostatic to normal. You're taking the drug, same thing, it will shift the homeostatic to normal. But if your homeostasis is normal, you take in the drug, yes, it is not needed in the body, it's not shooting anything back to normal. However, it shifted to abnormal. Then you exhibit some certain behaviors, and that behaviors can be can take you out of your senses and can lead to you doing things that are bad. As a to cover this, you should be able to identify whether that individual are taking these things. To have an idea also of how long will it take by the body to take care or to excrete the things, which we'll talk about. So I will make the class, like I said, in 3. So the first week, this is what we're supposed to discuss, I think, and then the second week we'll discuss. So this video will also come in this week. So I'll stop the recording for this and then start the recording for the next